Prosthetic joint infection case discussion. A 55-year-old female with a history of renal transplant and immunosuppressive therapy presents with knee pain and swelling 5 weeks after knee arthroplasty. She is on immunosuppressive drugs, including anti-TNF agents. Joint aspiration reveals a high WBC count, and cultures grows Staphylococcus aureus. Possible VIVA questions. How does immunosuppression increase the risk of prosthetic joint infection? The answer is, immunosuppressive medications, such as anti-TNF agents, reduce the body's ability to mount an effective immune response, increasing susceptibility to infections. These drugs inhibit the body's inflammatory response, making it harder to fight infections. What is the first-line treatment for this patient's infection? The answer is, the first-line treatment would involve surgical debridement and appropriate antibiotics based on the culture results. In this case, Staphylococcus aureus may require extended antibiotic therapy. Surgical intervention to remove infected tissue and a tailored antibiotic regimen are necessary for treating PJI in immunocompromised patients. What would be the long-term management strategy for this patient? The answer is, long-term suppressive antibiotic therapy may be needed for immunocompromised patients who cannot undergo complete surgical revision. Immunocompromised patients may have difficulty clearing infections, and chronic antibiotic therapy helps control the infection while avoiding surgery if possible.